Thanks so much for joining us for another edition of KFFB's Open Mic program. We do have Dr. Coward with us right now with Ozark Medical Clinic. And Dr. Coward, first off, we want to talk about the coronavirus and explain to the listeners what the different terms are when they say there is so many positive cases, so many negative cases, and then active cases. What is the difference in all that?
Well, you have the total number of cases that have been into the county would be total positive case that we've had. Active cases means how many patients that have active disease based upon their tests and symptoms. When you have an active case, you're either going to resolve and go into the resolve category, or you will not resolve and die, then you'll go into the death category. So you have negative cases, people who tested negative for it. The positive cases, people who tested positive for it. And that's a cumulative total. So that means, that's not going to go down. But the active cases will be changing on a day-to-day, week-to-week basis.
So when we really look at the active cases, that's those that have that virus in that county. So some may only have 4 in a county, or some might have 100 and some in a county, but that is all that is currently infected?
That is all have active infections. So when you get an infection, you have active infection, where you either have a positive test, a positive PCR test, the nose swab that you take down to the health department or to another lab that runs it. Either you got exposed to someone who has symptoms and you may not have symptoms and you can be an active case and not feel bad. Or you can feel bad, have the symptoms, and you test positive with the PCR, the nasal swab. And then generally we know after 2 weeks, your symptoms improve and you become a resolved case. Or sometimes it can take several weeks if you're really sick and in the hospital and you're on a ventilator. If you check another website, it talks about the number of people who are in the hospital with the COVID virus and the number of people who are on the ventilator. And that number changes. We can see our ventilator numbers are starting to drop over a couple of weeks.
That's true. I've noticed basically in the state, it's around 100 to 110 in the hospital. And then we've been in the 20s for someone on the ventilator, and it's never broke over 35 that I'm aware of watching it.
And that's really good news for Arkansas. That's really good news for us.
Now, one thing, too, when we look at the coronavirus, so when we look at active cases, that really means those that could infect someone, correct?
Correct.
Okay, when you say resolve, that means somebody that's recovered.
Correct. Resolve means recovered.
Okay, so those are some good terms for us to know. Arkansas has done a very good job, and that is the nursing homes. When they shut the nursing home down like March the 8th or 9th, where no one's allowed, they protected those patients.
Yes, that's been a very good thing on protecting the patients, but it's been increasingly harmful for the families who cannot visit the patients. And it's been really mentally getting worse for the nursing home patients from a different aspect. Mentally, depression is setting in. These nursing home patients that cannot see their family members who try to FaceTime their dementia parent really cannot understand what's going on and make sense. It's just not the same. So unfortunately, we see this a lot in medicine. As you treat one disease, a lot of mental illness rides right with it, whether it's depression or anxiety. And some of the nursing homes are trying to mitigate to try to slow it down. So we're hopefully, in the direction next several weeks, there can be plans, thinking outside the box plans that we can let family members visit their parent or loved one that is in the nursing home without having to spread the disease in the nursing home. So just making sure that whoever visits your parent does not have disease, which is not an easy task, considering all the asymptomatic carriers that are out there.
Now, one other thing we look at, so when we look at something, what number do you feel is the most important? Positive cases, negative cases, active cases, or recovered?
When I go back and look at it, I like to look at a 3-day average of cases, and there's a particular sites that do they just take the number 3-day average, and you start to see the curves. They're not as jumpy. They start to smooth off. Long as we see decreased number of new cases not exploding, and I think as we start to open up here, that's the number everybody's going to be watching. Arkansas has been doing very well. When you got an A in the class and you're taking the final, you got nowhere to go but down. So I think we will start seeing some increasing cases, but hopefully in a way that can be targeted, that we can pick out, where they're coming from and make corrections. But I think probably there's got to be I would expect a pickup in active cases as we start to open up a little bit.
And what would you say to the listeners? How can we be proactive?
Well, Proactive, I think social distancing, staying apart, do not go into crowded situations. What's been interesting, though, is Walmart has been packed these past 4, 6, 8 weeks during this time and across the nation, and no one has reported an increased risk of grocery store cashiers. To me, they were one of the highest risk people besides the ones in New York, the frontline people, the medical staff taking care of heavy hit areas. The highest risk person to get it is the grocery store cashier.
And that's what we got to watch for, too. And I do like the plexiglass. I think that's something that's helped a lot, the plexiglass.
Oh, those things help a lot. And washing your hands a lot between every patient, handling stuff. Plexiglass is a very good move.
Another thing we got to do, you got to congratulate your daughter who graduated last night.
Yes, we do. Family and few friends, 8 or less, got to get her name called. She's an honor student. Also, she worked very hard for that. 1 of 12 honor students this year in her class of 100 and 103. So I'm very proud. She worked hard. Very proud of her. Way to go, Emma Coward. Very proud of you.
And we are proud of all our Kansans as well, who has really done the social distancing. You got to admit, Dr. Coward, it feels like Arkansas really has rocked and done what they needed to do to get this curve down.
Yes, they have. And I believe we'll continue to do so as we open up. Arkansas will make good decisions to hopefully keep the numbers from increasing too much.
Way to go, for sure. We appreciate you taking time and talking with us.
Okay, thank you, Bob.